Tonight, the hidden condition ruining lives and often suffered in silence.
There's a lot of things that go on behind your eyes, in your head. I'm normally a happy-go-lucky sort of person, but you get yourself on your own and it can be a tough place.
Do women really suffer from depression more than men? Or is it that men just don't talk about it?
I'd go into myself, wouldn't speak to people. If something was upset me, I'd storm out of the house. Men are renowned for bottling things up. You know, well, I'm not going to say about that. I'm going to make myself look an idiot.
Good evening and welcome to the Tonight programme. It's a condition which the World Health Organization predicts within a decade will be more disabling than AIDS and cancer. Depression is an illness 1 in 5 of us will suffer from at some point in our lives, and experts fear the statistics mask a hidden epidemic of male depression because men are less likely to come forward to ask for help. Tonight, Penny Marshall takes a close look at the condition and the stigma which is still attached to it, and how the old adage of boys don't cry may lie at the heart of the trouble with men.
Deep in the heart of London, a night of comedy is raising awareness about a very serious issue. Confronting stereotypes and prejudice, tonight it's playing its part in challenging the stigma of male depression.
I like how it's called Depression Alliance. That sounds like a great add-on to Star Wars, doesn't it?
In the audience, Pete Cashmore, editor-at-large of men's magazine Nuts and a sufferer of depression himself.
It's an incredibly emasculating condition. It makes you feel like less of a man.
Tell you when there were a lot of depressed people, that was World War II. And
Here, the jokes flow freely, but the audience knows the reality of depression can be soul-destroying and far from funny.
during World War II...
It's a really good cause, because it is something that people in Britain still is a little bit taboo, isn't it? I mean, things are getting better, but
Yeah.
I still think...
There's still that sort of, I think especially with blokes, there's that attitude of just, get over it, mate. Get over it.
As adult depression continues to increase, so do concerns about men's inner lives and the consequences of their silence, prompting calls for a change in the way sufferers are treated and understood.
It takes things away from you like your sort of joviality, things like your libido, and it makes you cry a lot. And I think that there's men who find it difficult to kind of talk about things like that.
Depression in men's a hidden epidemic. It remains misunderstood and under-researched, sometimes a source of shame. But tonight, I'm going to ask what we can do to help sufferers and find out what the condition really feels like as we investigate the truth about male depression.
Wells up from within you, and I almost get the feeling of the world closing in, almost like tunnel vision. It sort of comes from the outside in.
You don't get much manlier than Bath rugby prop Duncan Bell. But he's proof that being masculine doesn't mean you can't be vulnerable too. Staying true to stereotype, Duncan hid his depression for years before recently being honest about it ahead of a mental health rugby conference.
I used to think, like a lot of people will think and have thought, that depression is a weakness, and you need to smile, and how hard can that be? But it is tough. It's not about smiling and being happy. Just because you've got a smile on your face doesn't hide a multitude of sins.
Some people think that depression has to be caused by a massive life-changing event of some description or a tragedy. What triggered it with you?
I think the ending of my marriage definitely sped things up. But I think it was always there. So even in my 20s, in my early 20s, a couple of times booked to see a GP about things and told myself to man up. Sitting outside the surgery, thinking to myself, what am I doing here? Let's go home. That can't be right. I'm I'm a man and I'm a rugby player and I don't need help.
It's important to say that depression is not something you can snap out of or pull yourself together to get out of. Depression is a very real medical condition.
Depression is primarily a disturbance of positive emotion, so you lose the ability to enjoy things, to look forward to things. Where it starts to become a problem is when things that should actually give you pleasure don't anymore. And if that goes on for up to 2 weeks, then you might start to think about depression.
Duncan Bell's depression lasted for 10 years before he finally confided in someone about it.
It was really the club doctor that took me to one side on a pre-season training trip, and he said, and all he said was, sat me down and he said, "How you feeling?" I was like, "Fine." He goes, "No, well, there's something up. What? Are you okay?" And I broke down. It was a real relief after I finished up. It was a real relief to actually finally tell someone.
For a decade, your teammates, living with you, mixing with you, didn't realise you were depressed. How did you hide it?
They didn't know until 2 weeks ago. I've been here 9 years. And I hid it completely and utterly. And I've always been involved with banter amongst the boys, being the brunt of banter quite a lot of the time, practically all the time. But that's a defence mechanism for me.
In fact, the men who suffer from depression can be hard to spot from the outside, their feelings of isolation and despair locked deep within.
There's a lot of things that go on, behind your eyes, in your head. So I'm normally a happy-go-lucky, always joking, especially around the rugby club, sort of person. But you get yourself on your own and you start getting lost in your own emotions. It can be a tough place.
Made even tougher because the trouble with men is they often don't admit to the trouble they're in. Today, the image of the tough man is firmly fixed in society. Man as hero, breadwinner, protector. None of these role models allows much room for any mental fragility.
Men are not really taught about how to deal with their emotions. They're not really taught how to language and narrate their emotions. They're not really taught how to think about their emotions in terms of the context of how they're living their lives. Now, you get this very much in cultures which require men to go out and do, particularly cultures that have been warlike, because you don't want men thinking about their emotions too much. You just want them to get out there and fight. You don't want them to start thinking about how frightened they are or how depressed they are.
There's very little data to show how many British men are currently struggling with depression. Numbers suffering can only really be based on the figures of those who seek help. Of those who completed treatment for depression and anxiety in England last year, 34% were male compared to 66% female.
There's a suggestion that men are much less likely to suffer from depression. Now, that may be partly because they're not as likely to come and talk to their GP about it, and they may suffer in silence. We know that men don't consult their GP as often. They certainly aren't as used to seeing their GP for routine tests. It may also be a bit of a macho thing, that women are more likely to talk to their friends, perhaps, and they may well, if they talk to their friends, be told that it'd be a good idea if they went and talked to their GP and got some medical advice.
Research has shown men are only half as likely to talk to their friends about their problems as women. Depression in males shows in other ways. Almost twice as many men compared to women drink when they're feeling down. Anger and drug use, particularly in young men, can mask underlying problems too.
Men tend to push away. They tend to hide away, they tend to self-medicate, turn to drinking, they turn to work. I'm failing, so therefore I'll do more and more and more. Now, you see this downward spiral of men going into more and more difficult places.
Professor Alan White suspects that behind the UK's alcohol and drug statistics, there's a silent epidemic of men suffering from depression.
Society has to prioritise something which is so fundamental. If we're seeing so many men struggling through alcohol and through drug dependency, what are we saying if we don't take it seriously?
I wanted to find out more about how the blackness, as it's often termed, manifests itself in men.
So I'm on my way to meet with a group of guys who are working their way through exactly that.
Macclesfield Town Football Club plays host to It's a Goal, an all-male support group. They use football as a metaphor to address their issues.
It's my base now, kind of thing for me to, you know, it's a solid foundation for me now to...
Brilliant. So you've got the goalkeeper and the defenders in, you've got your solid base.
Yeah.
Now you just need a bit of creativity in midfield and a decent striker and you're on your way.
That's it.
Brilliant. OK, Ad, do you want to talk a little bit about how you feel you've moved on since you've been coming?
Yeah, my confidence has grown with going out. When I first started the group, I couldn't spend much time with my daughter. I was unable to look after her on my own, but over time it's becoming more doable.
And that's a massive thing, isn't it?
Yeah.
All of the men here have completed an 11-week course. For some of them, accepting their depression and seeing how it was hurting their families as well has been a life-changing experience.
I'd go into myself, wouldn't speak to people. If something was upset me, I'd storm out of the house, I'd disappear for a couple of hours, I'd switch my phone off, then I'd come back in the house and, you know, I'd see the upset in people. And I'd think to myself, you know, right, it's me. It's obviously got to be me, I've got to get it sorted.
So as well as being withdrawn, did you find you were becoming irritable and angry?
It was making me irritable. You know, at work, something wasn't right, you know, or a machine packed in, you know, I'd kick the machine or I'd storm off, you know, I'd find something out of people's sight and I'd hit something.
At your lowest, what did your wife say to you that frightened you so much?
I'm going to leave you. You know, if this carries on, then it's the end.
And to be clear, she wasn't talking about you being depressed and withdrawn. It was the way it was manifesting itself and coming out in your relationship.
Yeah.
So how was it coming out?
I was doing a lot of shouting. You know, instead of listening, I was screaming and bawling at the kids.
Is it true, Paul, do you think that men just don't suffer from depression as much as women?
I do believe there's a lot of men out there that either don't realise it or just don't want to admit it, kind of thing. I disguised my depression with alcohol, and I didn't actually understand what was up with me. I had no one to talk, you know, to about it. I certainly didn't talk to my mates about it or anything.
Why does this group work so well? Does it make a difference that it's in a football club? Is that part of the... Yeah. Is it a bit macho that it's here?
Yeah, I think it does.
The clinical environment out of it is a big help.
Why?
Because I think there's a stigma going to a GP when you suffer from depression. If you take it out of that clinical environment, people are more willing to open up.
Psychiatric nurse Peter Sayers runs It's a Goal and says a lot of the guys tell him they find GP premises unwelcoming. He says they need non-clinical, more informal places to talk.
I think there's a myth that men don't talk, and I think we like to explode that myth. Men do talk, but they need to be given the right scenarios, the right situation.
We're trying to look at the ordinary man with the ordinary day-to-day depression that can be so debilitating. What is there out there? Is there enough out there to help them?
Well, I would say not. I mean, I think a lot more money needs to be put into those services. If you know, a guy goes to the GP, you're going to get your ordinary counselling services, you're going to get cognitive behavioural therapy, and if you're lucky and you live in an area where there's an It's a Goal project, you could get It's a Goal as well. But no, there's not enough money being put into the service. But of course, I guess that's the same for all NHS services, and all of them could say the same, perhaps.
The government has invested millions in improving access to counselling. In the years ahead, it could be that those services and charities too are called upon like never before. Because work, and staying in work, is crucial to mental health. Our Tonight poll revealed that those who are currently not working reported a higher rate of depression. 70% said that they've had depression in the past, or they have it now.
We know that 1 in 7 men will develop depression within 6 months of losing their job. And that has a huge effect on, first of all, for them, their ability to be able to get back into work and find work.
We know that improving access to psychological therapies reduces long-term sickness absence, helps people to get back into work and reduces their risk of relapse. Actually, in the long term, I would suggest we can't afford not to invest.
Experts have told me that men often see their jobs as a source of identity, that being in work gives them an enormous sense of pride. Well, with Britain heading back into recession, focusing on men's mental health couldn't be more timely. I'm off to see a man who's doing just that.
Well, let me tell you, I've been that man on the couch, I've been that man sitting down there, or that guy lying in his bed.
Duke McKenzie is a world champion boxer. For the last 7 years, he's been inspiring those who are down and despondent. Many of the men he sees at his exercise classes are referrals from the charity Mind, and an increasing number of them are unemployed.
If a man loses his job and all of a sudden he's unemployed, then that brings its own pressure, because then he can't pay his bills, can't look after the kids. So that makes him feel a bit inferior, because now he's not a provider. So what does he do? You know, goes into a spiral of depression. And it's very hard to pick yourself up out of that position.
So crucial time for you and the gym, providing help for men facing these sort of pressures now.
Well, what I do is give everybody the mindset of what it took for me to become a world champion. So then that gives them a leg up straight away. I get into their head a little bit and I talk to them and I make them think they're at Caesar's Palace fighting Sugar Ray Leonard for the World Welterweight Championship. And then that gives them a self-worth. It starts with just a small grain. It starts with just a little, you know, a reach out and touch kind of feeling. And if they do that, then they're going to get help. And then you're going to have less cases of guys, you know, doing crazy things.
It's those crazy things, that spiralling out of control, that most concerns those working in mental health. Statistics show that the suicide rate in men is much higher than it is in women. Of all the suicides in the UK, men make up 75% of them. And whereas other suicide rates in males are falling or stabilising, they're rising in men over 45. Guy Bernard was a few years shy of that, but as he entered middle age, he took his own life. He's terribly missed.
He was a very outgoing, gregarious character, always the centre of attention at parties, always having a joke.
In June, it will be 5 years since Guy killed himself. He and Caroline had separated, but his children, Harry and Lottie, spent weekends with their dad.
He kind of went through a stage where it's just, like, I just didn't really understand what was going on. Like, I'd see him come home from like work and that, and he just was a different person. Like, it was like he wasn't even there, in himself almost. Like, it almost, like, the depression or I suppose could taken over, I suppose, maybe.
I think he was definitely finding it more difficult to hold on to that image that I think he was just scared of, I think, ruining what people saw of him, which was this funny, bubbly guy.
Guy had had bouts of low spirits before, but his family knew little of the real distress he was in.
He had a good crew of mates around him, you know. His male friends were very important to him. And, you know, up until the day he died, you know, he was on the phone to one of his closest friends half an hour before he died. He didn't really confide, I don't think, in anyone particularly about how bad things were for him.
The children and Caroline have decided to speak out because they're desperate to highlight the terrible impact suicide has on families. The pain from that day will never go away.
I don't know, I was just in complete shock and numbness. I went to my parents and, you know, we were all very upset, and it was, my worry was, what do I tell the children? How do I tell the children? How do you tell your children, you know, that their dad's killed himself?
Because it's horrible, like when anyone dies, but this is so preventable that you want to do something about it.
You don't see boys crying or telling each other, like, how they're feeling, how their life's... Like, you do, like, oh, yeah, I've been doing this and that. But you don't go into detail, like, there is things that I just keep to myself because it's what a man does.
But history suggests men haven't always kept so much to themselves. For depression in men in particular isn't new. The Black Dog was never far from some of history's most famous men.
Winston Churchill, of course, wartime Prime Minister, is famously described to suffer from depression, which he called his black dog. And I think this might give us some sense of how he felt. Certainly it was a constant companion to him.
The National Portrait Gallery houses pictures of the good and the great amongst men, but it also charts changing expectations of them.
If you look at the Georgian period, it was really common for men to be quite reflective about their psyche, to exhibit nervous symptoms, and the nervous system was seen to be quite important at this time.
So there was no stigma then for men to be depressed, then it was acceptable?
Yes, it wasn't crossing any boundaries about acceptable behaviour for men, so it was seen as very common.
When did it then change?
Well, a lot of changes take place in the Victorian period. A number of sort of social and cultural and political factors take place. Not least, of course, we have industrialisation, which begins to draw a division between men and place of work and women who were seen to be more suited to the home. And you have Imperial Britain. I mean, the idea of Britain being great and strong in the world didn't really fit very happily with nervous instability in men. You get this real association with weakness, which I think is, we're still suffering from the hangover of that today very much.
That may explain why so many men remain unwilling to admit to depression or don't find themselves even able to comprehend it. 25% of the men we surveyed agreed with the statement, "I don't understand what depression is and how it affects those who have it." That's compared to 11% of women.
I think the fundamental issue here is that we haven't helped men to recognise emerging signs of poor mental health in themselves. We haven't created services that are responsive to men being able to feel open about talking about their mental health. And we haven't yet created a system that deals early on effectively with poor mental health amongst men.
It's obvious there are huge challenges in helping men identify depression, seek help for it, and combat it. But are we seeing the beginnings of change?
I would hope so. I would sincerely hope so, that we're in for a change with guys with mental health. It will really benefit men if they get more help from, people like myself or guys like Duncan Bell that are out there, that people actually look up to and see these guys. And if they can identify with them, it can happen to them, it can happen to me. If they can get help, then maybe so can I.
For people listening who still think big boys don't cry, come on, man up, what would you say to them?
Well, they don't get much bigger than me. I do cry, unfortunately. As much as you don't want to, sometimes it's good to get you to open up and to get things off your chest and to talk. And if you can't do that to your friends or family, then I urge you to go and speak to a counsellor, because they really are a godsend for me.
When people take a stand and speak out, whether it's the sufferers themselves or those affected by the condition in a man they love, perhaps it indicates that times are changing and that our men are too. I've certainly seen change in the guys working hard to support their fellow men and in the charities working hard to see off the stigma. But it's the men themselves openly talking about their experiences that makes me hope we have reached a turning point.
It's a horrible condition. It's an insidious condition that sneaks up on you, gets you when you're weak, gets you when you're feeling low. And if you can rise up against that, then that's all the manliness that you need to display.
Now, if you've been affected by tonight's programme, or if you're worried about someone you know, please visit our website at itv.com/tonight, where you'll find specific guidance from a GP and lots of numbers to call for help. Until next time, good evening and thanks for watching.